everybody, fellow travelers. My name is Leslie Klipsch. I will be co-leading this trip with Ann McGlynn, and I am so sorry that I couldn't be here in Davenport this evening. I am in Des Moines at a fundraising event for Empower Tanzania, but I did want to tell you a little bit about the organization and about some of the people that you will meet next spring. Tonight we're raising money actually in Des Moines for our women's empowerment programs. And really this trip is all about women's empowerment. It's about empowering you and helping to learn the stories and empower the women that we work with in Tanzania. So a couple of the things that we will get to witness on this trip next spring are different health programs that we run as an organization in and around Same Town, Tanzania. You will meet community health workers, and these are women that Empower Tanzania works with. We've trained them, we've given them education, just very basic health skills and medical skills. In the areas that you'll visit, you'll see they're very, very remote. There's not a lot of healthcare facilities, let alone healthcare professionals in the rural areas of Tanzania. So we've trained these workers to identify major health issues and provide a liaison from villages to healthcare clinics or hospitals. So for instance, if there's a child that suffers from a burn wound, they know basic first aid, they have the supplies to help those children, and they are able to discern whether that child needs further help or not. The same thing with pregnant women. So the community health workers are able to identify complications, prenatal complications, and they know when a woman needs to be transferred to a hospital or a health clinic for further care. So you will meet some of the community health workers on this trip. They're incredible, empowered women. We also will be meeting community health educators, and these women are trained with basic health knowledge that they share with members of their community, whether it's at a school or in their church or at a community hall. They have meetings each month. They're educating others and having an incredible effect. The program as a whole, the 33 women involved reach over 17,000 people every month with just basic health messages. So when we travel next spring, we will meet a few of those community health educators, and maybe we'll even get to sit in on one of their meetings. You'll meet farmers, women farmers in our integrated farming program, and I can tell you they are inspiring and incredible. And you'll also meet women who are now entrepreneurs that were once victims of gender-based violence. So these women have gone from victims to survivors to entrepreneurs through our program. We've had counseling with them for the last couple of years. There are 100 of them, and they are now making batik fabric, they're making liquid hand soap, and they're creating reusable menstrual pads that they are then selling. So not only are they helping their communities with these items, but they're also making money for themselves, which leads to further empowerment for these women. So those are just a few of the programs that you will get to see if you travel with us next spring.